Here we're going to start with the basic skeletal anatomy of the skull, and we're going to go through the adult skull first, because if you learn all of the structures in their fully formed appearance, it will make identification of the same structures on the fetal skull much, much easier. So let's get started with the adult skull. Here we're just going to cover the fundamental anatomy of the skull. We're not going to go into great detail. But to start, I'm just going to name the major bones that we're going to cover, and then later we'll go into the parts of those bones. So looking at this, you have your frontal bone right here, parietal bone, the right parietal bone, the right temporal bone, and these are bilateral, so you have two temporal bones, two parietal bones, one frontal bone, and then back here, one occipital bone. If we look at the anterior view, we have the zygomatic bones that form your cheekbones. We have the upper jaw called the maxilla, the lower jaw called the mandible. And then right here in the nasal cavity, we have the perpendicular plate of the ethmoid bone from superior aspect to about right there. And then from there forward into this tip would be the vomer. So if I just zoom in here, you can see these are the two bony plates that make up 2/3 of your nasal septum. What is missing here is the hyaline cartilaginous tip. But if we look right here, this pointy projection, that is your vomer. And the bone itself is kind of an arrowhead shape. Also, you see in this view the nasal concha. You see the middle and inferior sets of nasal concha projecting from the lateral aspects toward the septum. There's also superior nasal concha up here, but you don't see it in this view, and you wouldn't see it in this model. This is a nylon injection mold, so the detail gets lost. Okay, we're going to start with an inferior view here, looking at the occipital bone first. This is all of your occipital bone. This right here is your external occipital protuberance. This is the foramen magnum, where your spinal cord will exit the skull. Bordering the foramen magnum, you have these two condylar processes, these articulating knobs, and these are called the occipital condyles. This is where C1, the atlas, your first cervical vertebrae, will articulate with the skull. Looking a little closer, I'm going to break this up, but sticking with each view because it's easier just to name the parts in the current view. So this is actually the roof of your mouth. This is an inferior view. This is your mandible, right here, the lower jaw. This is the upper jaw, the maxilla. And this is called the palatine process of the maxillary bone. From the front by the teeth all the way back to this little suture right here. This is called your palatine suture, right there. And then behind that, or posterior to that, is the palatine bone itself. So the posterior third of the roof of your mouth is made up of this small palatine bone. Also in this view, looking at portions of the temporal bone, just angle this down a little bit more, you can see the mastoid process on either side from each temporal bone, and this small styloid process from each temporal bone. While we're in this view, right here, you would have a jugular foramen, and we'll use a blue probe because it's carrying deoxygenated blood. And then anterior to that, right here, you would have a carotid canal, which carries oxygenated blood through the carotid artery. Okay, let's remove these and look at an intracranial view. So now looking at this intracranial view, again, we can see the foramen magnum here. I have it propped up on the cranial cap, so that's what you're seeing there. Right in here, at the bottom of your screen, would be the internal occipital protuberance. Once again, you have a jugular foramen here, and on either side, the carotid canal, right there. While we're in this view, you can also see your optic canals, where the optic nerves would enter the skull from the eyes. If I just turn this around really quick, that's what you're seeing. While we're still in this view, take these out. You can also see at the top of the screen here now, This is the crista galli of the ethmoid bone, surrounded by the cribriform plate, also a portion of the ethmoid bone, and it has the olfactory foramina in it. Those little perforations, that's where your olfactory nerves will descend down and embed into the nasal mucosa of your superior nasal concha, so that when you breathe in, the little particulates bind with the sensory neurons, creating an action potential, and you smell whatever fragrance or aroma that you can smell, or odor, whatever the case may be. Also in this view, you can see the lesser wings of the sphenoid bone, and down here, the greater wings of the sphenoid bone. It looks kind of like a bat wing. And this structure right here is called the sella turcica. It translates to Turkish saddle. So from this point to this point. And right here, at the base of the saddle, is the hypophyseal fossa. That's where your pituitary gland would sit. So we'll look at the lateral aspects of the sphenoid bone in an external lateral view. So here's a lateral view of the skull, and in this view you can see the right parietal bone, the coronal suture here that connects both of your parietal bones to the frontal bone, your frontal bone here. You can see the squamosal suture, which is connecting the temporal bone to the parietal bones. Right here is the lateral view of the sphenoid bone, the greater wing. Here we can see the mastoid process of the temporal bone. Anterior to that, you can see the external acoustic meatus. Anterior to the meatus, you can see the mandibular fossa right here. This is where this mandibular process and the mandibular condyle will articulate with the temporal bone, forming the temporal mandibular joint. Right here, you see the zygomatic process of the temporal bone, all the way up to this little suture. And then this is your zygomatic bone, your cheekbone. And from the probe back to this little suture, that would be the temporal process of the zygomatic bone. So collectively, these form your zygomatic arch. Also, in this view, we zoom out a little bit, come up a little bit. You can see right here, up to this suture, is the zygomatic process of the frontal bone. You can see the mandibular ramus right here, the angle of the mandible, and then all around is the body of the mandible. Mandible being your lower jaw. If we turn this slightly anterior like that, you can see the mental protuberance right here, and on either side of that, you have another foramen called the mental foramen, or plural would be the mental foramina. The mandible and the maxilla, your upper jaw, have these alveolar processes, these little bumps that form the sockets for your teeth. Okay, alveolar processes. So moving up from there to the maxilla, your upper jaw, it's a large bone. It extends all the way out here to this suture, where the maxilla ends and meets the zygomatic. So we call this the zygomatic process of the maxilla. And again, bilateral symmetry, so same on either side. Right here, we have the inferior orbital margin of your eye socket. Inferior orbital margin, this is known as the orbit. This is the superior orbital margin. Now, what I want you to see is here you have two foramina, and down here, two foramina. These up here are called the supraorbital foramina. And as long as they've developed this little bridge of bone that completes the circle, that's a foramen. If that little bridge of bone did not form, they would call this the notch, and that's exactly what it would look like, a supraorbital notch. And then down here again, the infraorbital foramina. A few more things to look at here. On this posterior view, again, this is your occipital bone. This is your lambdoid suture, which is connecting the occipital bone to your two parietal bones, and then running right up the center of your skull is your sagittal suture, which connects the two parietal bones together. We come back around to this anterior view, and we zoom in a little bit. In this view, you notice a small suture right here. That's connecting your two nasal bones. So you have a small nasal bone here and here. If we turn this a little bit to the lateral, this extension coming all the way up is actually the most superior extension of your maxillary bone. Next to that is the lacrimal bone, and you can see your lacrimal canal right here. And then again, more posterior to the lacrimal bone is your ethmoid bone. If we look inside the orbit of the eye, you can see the optic canal that I pointed out when we looked at the intracranial view. And next to that optic canal, you can see a superior orbital fissure and an inferior orbital fissure, true on either side, in either orbit. So that is a quick view of the basic skeletal anatomy of the skull.